A few weeks ago, Talking HealthTech attended Digital Health Festival in Melbourne, and we had the opportunity to speak with a number of key influencers and decision makers who featured on the agenda. You can go back and check out episode 360 of this podcast for the full feature episode we recorded at Digital Health Festival at our booth during the event. Now, I was also lucky enough to spend some quality time with some of our THT Plus company members at their own exhibition booth at Digital Health Festival to record some dedicated feature episodes of this podcast. One of those conversations I had was with Jayne Thompson from MediRecords. And in this episode today, you'll learn about their makeover and launch of MediRecords 2.0. You'll hear all about the enhancements they're making to the platform that they're excited to launch. We'll understand their commitment to multidisciplinary care and how they're supporting healthcare providers in delivering efficient and innovative solutions. Collaboration starts with a conversation, Team HealthTech. Let's make it happen. This is Talking HealthTech with me, Peter Birch, featuring content and community about technology in healthcare.
So my name's Jayne Thompson. I'm a head of product here at MediRecords. I've been in health tech for about 12, 13 years or so. Actually just really fell into it by starting out in pharmacy and really just fell in love with health software from there. Worked across pharmacy, hospital, virtual care, and then most recently here in MediRecords. Been with us here for almost 2 years or so.
Wow, okay. And what do you do at MediRecords?
So I lead our product function. So I'm very lucky to lead a fantastic team in product. We have our product owners, business analysts, designers, and our delivery team.
Yeah, and MediRecords, the product. Tell us a bit more about that.
Yeah, so MediRecords is a digital health platform that was founded in 2014. I think with the vision of being the first cloud-based practice management and clinical system for GPs, but really has a framework underneath that really supports truly multidisciplinary care. So we've seen GPs, specialists, even allied health, and more recently hospitals, but for supporting hospitals by way of things like billing and even electronic prescribing and, mental health, etc. So
that's interesting. The growth of MediRecords from what I knew of MediRecords back in the day to that point in the outpatient, almost like family GP setting, and I guess the largest opportunity there would be in like the corporate groups of those little clinics. So how has that evolution kind of gone from just the single clinics to this kind of plethora of almost being like the poles and wires of health tech?
Yeah. I think the way that MediRecords was established around everything having multiple practices across the one single tenant and allowing, access of patient information and clinical records across each has sort of set up the framework. But even large contracts and deals that we've been working through is taking us all the way from primary care even into like low acuity admission care. We're working on a key project with Australian Defence at the moment, which is really seeing MediRecords as the platform all the way through, which is quite an exciting space. So that
defence contract, we can't just gloss over that. So tell us a bit about explain that a little bit.
We're so used to it that I just mention it at all times.
It's not a typical contract as far as I'm aware.
Yeah. So prior to myself joining, I think the initiation of discussion around this project with Australian Defence started some 4 years ago or so, but really ramped up all last year. We've scaled the business substantially to be able to support it across product and technology primarily. What the solution is it's the health knowledge management solution for ADF. It's a consortium of vendors. The first phase is ourselves who are performing primary care, inpatient care, very much like a low acuity inpatient solution. So complex care is often handled via transfers out of facilities, as an example. And the patient portal, that's all being handled by ourselves. And then we're integrating to other vendors like Alcidion for longitudinal health record, Fred IT for pharmacy, Titanium for dental, and then the list goes on with further phases into further years.
But there are other kind of big, like we've seen those big announcements for some of those larger form contracts as well. I know from a vendor's perspective, sometimes, particularly from a product side, that one thing you don't want to do if you're an earlier stage organization is you get a big contract and then that becomes like just what you do and that's like your thing. But it sounds like it's a solution that will definitely solve for those points and that'll be a big priority, but there's other areas too.
Yeah, I think it's so important to continue to innovate and continue to evolve. I think naturally MediRecords probably attracted a more innovative customer base from the first instance. And I think showing dedication to that innovation ongoing is really important. I think throughout COVID of course changed everything by way of virtual care. And since then, virtual care has been a huge growth area for us. Just as a cloud-based solution, I think naturally it helps support, geographical locations, providers to be able to, log in from outside of clinic walls or typical bricks and mortar type setting. So having to evolve off the back of virtual care, and then how does that actually continue to apply and at scale when opportunities come up? Like we've had a couple of opportunities around, virtual emergency department with Northern as an example, and My Emergency Doctor, and even more recently in Queensland Health, looking to expand into some clinical aspects. So I think, honestly, I really think it's about evolving and responding to needs of the customers where we can, and showing that scalability, which we absolutely have. And I think now we're seeing a real use case in the market for it.
Yeah, absolutely. Tell me a bit more about 2.0. So I think you touched on it, but let's go into a bit more detail what that is and what's happening at MediRecords.
Yeah, very excited about 2.0. I could talk about it all day. So it's essentially it's really introducing the next phase of MediRecords. So the first part of it is actually our new user interface. So MediRecords, this is really about a new, fresh look and feel, and I hope our customers see it as a dedication to ongoing customer experience and user experience. It's got a much more simplified palette, but more importantly, we're looking at utilising every single pixel on the screen. So there's no dead space anymore, more information for optimization and that sort of thing. So really hoping, but at the same time, we've kept muscle memory and kept enough, familiarization within the product that there's no major changes or change management. It's just, I'm really hoping our customers respond really well to it.
Because I know when I use like a cloud thing, you wake up the next morning, you're so used to like clicking this thing up here, and you're like, wait, it's not there anymore. And then it's like those little things jar you. Like if you're not prepared for it, you're kind of like,
oh, I know.
It takes you by, and then it creates all these emotions. It's such a funny thing, like that kind of product. So that you as a product manager, like, you must be thinking about this a lot.
All the time. So it's really important to we talk about sort of primary actions and the actions that we're hoping people navigate around the system, making sure that they're really prominent, really obvious, and we're not changing things that are really core to a workflow. Because that's like social media apps are a classic, right? You log into your phone and all of a sudden you're like, oh, how do I get to that again? And you're outraged and offended for a minute and you're over it in 2 days. But it's true. And so it's really important to keep core workflows the same where it makes sense, optimizing them where possible. Like we've looked at streamlining, been really conscious of things like click count and how do we make something that's 10 steps? Can we actually make it less steps? And, really looking at that where possible, but keeping a core workflow and behavior and what we refer to as muscle memory. So where you expect things to be are still there, and creating familiarization in the app's really important as well. Every screen should look and feel at least harmonious, and where to go. Top right is where you create new, for an example.
Yeah, but there's all the things that come along with it too, like I imagine all the screenshots in the knowledge base. Now I'm in my head, I'm just like, wow, that's like a lot of like getting things ready, because on one hand you want to be able to hold everyone's hand through the process, but MediRecords I think is probably at a size now that you literally can't be on the phone to every single new customer and take them through step by step. But how do you deal with that? Doing things, like you say, in a scalable way, that by definition, the product is super scalable. You need the support to be able to scale as well.
Oh, I know, and it's really challenging. I'm sure the customer support and customer success teams have hated me at times, but we've essentially been working through this phase. The new UI has been in the works for probably almost 9 months, I'd say, on and off. Like when we started circulating the designs, talking through the changes, even internally, what do we need to make sure that we're covering? Knowledge base is a really good point. It's so great having extensive screenshots to step people through the product. But when you're changing almost every screen in the product, or you are changing every screen in the product, that's been a real journey internally. It's meant that we've gone through numerous rounds of regression testing and feel really comfortable with the outcome. It's been a real journey to update all documentation, all references. We're going, our initial go live will be with a pilot sites of 7 customers, where they'll have the opportunity to use the new, give us feedback, make sure that, just to check with all the workflows that we've run through, making sure that in the real world, it's all active and working as we expect. And that's due to kick off at the end of this week, actually.
Yeah, right. Yeah, so by the time this recording comes out, they would have been through the process. And I imagine then, because, one thing for, particularly in the outpatient care side, clinic owners looking at practice management systems, a lot would be thinking, well, I need to move to the cloud. It's not a matter of if I move to the cloud. I need to make this transition. MediRecords has been in market for, like you say, nearly 10 years now. So, got some good runs on the board in terms of feedback and experience. So it's probably a good time for someone to come on with the refreshed look and feel to
I
get
think
in.
so.
And use it.
And we've had a number of customer sessions where we've had, 80 plus attendees. We've done these lunch and learns where our training team have run you through, these are the changes, this is what it looks like today, this is what it will look like. And the feedback has been overwhelmingly positive. I was expecting a little bit of apprehension because change, can be scary, but the feedback has been really positive. I think it's a response to how clean and neat it is. We've got increased accessibility and the UI is absolutely an improvement for the better. That's not a dig at the current. I think it was incredibly forward thinking back in 2014, 2015. But I'm surprised that our customers particularly have responded really positively to it.
Good time. And so then looking ahead, and so you've got a few plates spinning because you've got new customers. Are there any other big things that you're working on right now that you're excited to see the outcomes from?
Yeah, so I think 2.0 really is the kind of the introduction of this next phase. The UI is the first part, but then we're really standing up the framework to release a whole heap of extended capability over the next coming months, some sooner than others, but just things like a real focus on, honestly, it's about feeding information back from the customer in. Like, we've been in market now for about 9 years. We've got a lot of customer insights that we've now got this opportunity to start feeding that into the product. We've structured ourselves even internally. We've kind of gone through really a clarity of message and offering in the market around our 3 core pillars being care, connect, and engage. So care being our care platform, which is obviously in use by clinicians, doctors, etc. Our Connect platform, which is our integration platform, and both our REST and Fire APIs. Our Fire API journey being something we've been undertaking for about 6 to 9 months now. And our Engage platform, which is currently our mobile app, but is something that we're porting to a web-based portal, which will have a whole heap of extended functionality around bidirectional communication back to the care platform. So even just creating that clarity internally first and then that messaging in market to get a really clear message of this is the kind of health care problems and these are the kinds of solutions we can provide out to the healthcare ecosystem, basically.
Yeah. No, good one. Well, look, I know you're going to be jumping on the stage soon at Digital Health Festival, so we'll have to give you time to prep for that. We'll make sure all the details for MediRecords are in the show notes of this episode for people to check out and get in touch and learn more about 2.0 because it'll be released by the time of this episode going out. So, Jayne, appreciate you making the time to have a chat.
Thank you so much for having me.
For more content and community about technology and healthcare, visit talkinghealthtech.com.